What's there? Good morning and welcome to the Monday morning briefing on COVID-19. Today we have with us our Director of Public Health, Matt Constantine, and our Chief Administrative Officer, Ryan Alsop. I'm going to start by handing it over to our Director of Public Health, Matt.
Thank you, Megan, and good morning. This Monday morning we are reporting that there are 72 new COVID-19 cases in Kern County residents. As I do every time we meet, we try to provide an update on some of our skilled nursing facilities. We are struggling with getting consistent and accurate numbers from the state. So the numbers that we reported on May 27th is the most accurate. So for Kingston, that was 54 healthcare workers, 80 residents, 18 residents that have died. And for Valley Convalescent, as we reported last time, 19 healthcare workers, 40 residents, and 4 residents that had died. We are trying to get more accurate numbers. The state has been sending conflicting information, so we will try to remedy that as quickly as possible to provide the most accurate information. I will also note that the information on the website even contradicts the data that I've given you from what the state reported to us last week. So we'll ensure the state cleans that up. We did receive 2 more shipments of remdesivir. We received 130 doses last week, and today we're expecting this week we're expecting 167 additional doses. Those initially come to public health, and then they're quickly distributed to our local hospitals. And then finally, our skilled nursing facility testing program remains active. We are going to Delano District Skilled Nursing Facility tomorrow and Wednesday. We'll be at the Bakersfield Rehab Center on Thursday and the Parkview Skilled Nursing Facility on Friday. With that, I'll turn it back to Megan for an update on our testing.
Thanks, Matt. So we continue testing throughout the county. We continue to have 4 state-funded sites. Just for your information, those are at the Kern County Fairgrounds. A point of clarification, that location has moved to the Harvest Building at Gate 40. So if you were planning on going and were thinking it was at the other end of the fairgrounds, it's now at the Harvest Building. The Mojave Veterans Hall is out in Mojave on O Street. The Arvin Public Health location is on Hill Street, and the 5th District drive-thru is still open until June 3rd. Their last day of testing is Wednesday, June 3rd. We also have county-funded sites. They are at the Good Samaritan Hospital in Oildale, the Westside Healthcare District in Taft, the Adventist Health Regional Medical Center in Delano, Kern Valley Hospital, Ridgecrest Regional Hospital, and Adventist Health in Tehachapi. We are also looking at a location in Lamont. We don't have the finalization on that, but we do anticipate having that information in the coming days. So we continue to look for locations where it makes sense. All locations require an appointment. You can find that information at kerncounty.com. There's a big testing button right on the front page. And currently we are up to 4,700 tests just at our locations. Really quickly, I also want to thank the City of Arvin staff for really promoting their site and making sure that their residents are aware and informed. With that, I'm going to turn it over to our Chief Administrative Officer, Ryan Alsop.
Good morning, everybody. Today in Kern County, population 900,000 plus, nearly 29,000 residents. have been tested for COVID-19, coronavirus. Over 25,000, or nearly 90% of those tested, are negative. We are seeking the results of 914, or about 3% of those tested, and 2,322 residents, or about 8% of the total number of people tested, have tested positive. Today we have 53 residents receiving some form of treatment in an area hospital, and we have had 38 people, unfortunately, pass away. Today, of the 2,322 residents that have tested positive for COVID-19, 2,231, or 96%, are either fully recovered or are recovering at home, treating their symptoms on their own. Today, 53 residents, as I said, or about 2% of the total tested, are receiving care in an area hospital. 38, or about 2% of the total number tested, have died. Over half those deaths continue to be attributed to a few different state-regulated skilled nursing facilities in Kern County. It is important that we continue to follow the guidelines set forth by the state, continue to do a good job washing our hands, not touching our face, staying home if you're sick, not going out and getting around large groups of people. And going forward, monitoring is going to be monitoring across the board on all of our different data points related to COVID is going to be critical. The governor has said last week that this week he'll likely begin moving into the early parts of stage 3, moving the entire state into stage 3. Obviously, those counties that have submitted and have been approved for attestation, the county variants are among those counties that will begin moving into stage 3. Before we move into stage 3, if you are a business that has existed in stage 3 and have been awaiting orders from the state, we need to wait to receive guidelines from the Newsom administration on how you open before you get going. Again, the good news is that the governor has alluded to the fact that we would begin moving into stage 3 likely as early as this week. Those guidelines for those businesses in that stage are forthcoming, and we're going to be getting that information out to you as quickly as we get it, making sure that you have it and understand all of those guidelines as you begin to contemplate how you reopen. Monitoring of critical criteria related to COVID, hospital capacity, testing capacity, the number of positive tests, the rate of those positive tests. All of those things are going to be continued to be monitored by both the state of California in cooperation with our local public health officials. It's important that everybody understand that those data points are critical to determining changes that could happen, that could affect the speed, the scope at which we reopen our economy. Things like hospital capacity, again, is a very, very important data point and a readiness criteria for Kern County. It's important that we maintain available readiness to serve in our area hospitals, maintain available ICU beds. Again, this is not just for those who have COVID-19 and are suffering from symptoms of COVID-19. Most times, if you're in the hospital, it's complicated by other pre-existing conditions. So it's not just about COVID, it's also about folks that are in car accidents, who have heart attacks, who have any number of other medical problems that are requiring hospital visits, and certainly a hospital bed, certainly an ICU bed. So it's important that we continue to do our part in making sure that we are following guidance, that we're being careful, that we are taking a measured approach to getting out and about, and again, washing our hands, wearing a face mask if you are in a group of people and can't social distance properly. It's recommended that you do that. Maintain your distancing and just be smart. And we thank you in advance for that. And with that, we're happy to answer any questions that you might have.
Okay, as you received the order this morning, we're going to go down the list. Please remember not to unmute your line until you've actually been called. That prevents any background noise that we may hear. And we'll start with our first organization, the Bakersfield Californian. Do you have any questions?
Hi, yes, I do.
Go ahead.
Ryan, I wondered if you could say if you've had any meetings or discussion with the state so far about these data points or the reopening plan that was submitted and approved by them to allow the county to reopen earlier. I believe that there is going to be perhaps like a weekly meeting or something going forward with the state.
We'll have Ryan answer that. Hold on.
Yeah, Stacy, is that you?
Yes.
Okay,
Yeah.
yeah, we have daily discussions with the state on our attestation, on the various data points, the various criteria here in Kern County. We have daily conversations that doesn't end on a Friday. There are discussions, emails, things happening over the weekend, but it's a daily conversation with the state.
Okay, thank you.
Next, we have Kern Radio. Do you have any questions?
I do. Good morning. It's Ralph Bailey.
Good morning.
Given the behavior of our citizens over the last 72, 96 hours, I think we can assume there's going to be another spike in cases here in Kern County, given the mass gatherings and whatnot. Is there a fear that we could fall out of phase 2? And what would define that? What would we have to do to fall out of phase 2?
I'm going to have Ryan address that question, Ralph.
Yes, there is a fear of not being able to open up stage 3 businesses. There's a fear with sustaining that reopening and sustaining those reopening protocols under the governor's guidance if and when certain data points, and there are many, are impacted in some way. If we see an uptick in, again, hospitalizations, which is affecting our hospitalization rate, or if we're seeing a change in the number of positive cases that we get under the again, the parameters that are put out by the governor that the counties are to follow, those are all concerns for us. And I guess the short and direct answer to your question, Ralph, is that, yeah, I mean, that's a real possibility. And within any of the areas that have been outlined by the governor that the county is to be following, if any of those areas get out of compliance, that could potentially mean changes again to the speed and to the scope of our local reopening here in Kern County. So it's something that we need to be aware of. And again, it means that we need the public's help in adhering to guidelines, practicing social distancing, doing all these things that we've been talking about for really forever. It's very important that we continue to do that.
Now that we're in, I have one other question. Now that we're in phase 2, our hospitals and elective surgeries are coming back. Are hospitals getting back up on their feet? Are folks feeling good about going back to hospitals, folks that do not have COVID?
Ralph, I'm going to have Ryan try and answer that question. I'm not sure that either of us, any of us, have a really good answer, so we'll give it to Ryan.
Yeah, Ralph, it is true that hospitals are opening up and doing more elective surgeries, et cetera. I don't know. I don't know if I can answer your question fully. I just don't have any good information on that. It would be, I think, probably a question to direct to some of our hospital administrators here in the community.
And final, and I'll leave. I'll get out of this thing. Is the county doing any autopsies on COVID fatalities?
So Ralph, that's a question the coroner would likely have to answer. If you want, I can research that after this and have someone get back to you.
Thank you.
Will do. Okay, next we have Channel 23. Do you have any questions?
This is Kylie. So I just wanted, just really quick, going off of his question, I wanted to confirm, were you saying that we might not move into phase 3 if we do see that uptick?
Let me have Ryan clarify his statement.
Thank you.
Kylie, if we see any significant changes across a large set of data points related to our ability to test, our hospital capacity, our positive rate, our ability to contain and be ready to deal with COVID in our community. Again, it is here, it is in our community, it will be for months and months ahead. If we see changes that are disrupting our pattern of readiness to serve in our hospitals, if we see any sort of negative change in our ability to contain, test, be ready, any of those, yes, could impact our ability to get more fully open and certainly has the potential to impact our ability to reopen in stage 3.
And so another question I had, so are we prepared for that surge if it were to happen?
Yes, we are.
Okay, thank you.
Okay, we'll go to our next outlet, Kern. Do we have anyone on the line with questions?
Hi, this is Elizabeth. My question is about the forgivable loan program that the county's working on. Is the county still accepting applications from small businesses, and is there a deadline to submit those?
They are still accepting applications. I'm not sure of the deadline. I believe it's until the funding is gone. But they are currently accepting applications, and you can go to kerncounty.com. There's a button right on the front that says Kern Recovers, and you'll apply through one of 4 local financial institutions.
Is it possible to let us know how much funding is left or how much funding has been given out so far?
We do not have that number.
Okay, thank you.
Uh-huh. Our next outlet is Mojave Desert News. Do we have anyone on the line with questions? Okay, Channel 29, do we have anyone on the line with questions?
Hi, this is Tyra Majors of Channel 29.
Hi, go ahead.
My question is about the 105 new cases that were confirmed over the weekend, and just about this massive spike. What exactly are these cases accounting for? Do we know where they rooted from, or why there was such a large spike over the weekend?
Tyra, can you take a stab at that one more time? There was some garbling of your mic, so if you could just state the question again.
Absolutely. Let me know if you have any trouble again. My question is about the massive spike in cases over the weekend. There were 105 new cases confirmed at once in one day. Just wanting to know what exactly that is accounting for.
We'll have Matt address your question.
Good morning. Yes, the number of cases was high. Today, too, we reported 72 cases, which is high. We are not able to pinpoint a cause. As COVID runs through our community, we expect there'll be variations in the numbers. It is a really good reminder that we all have individual responsibility to protect ourselves and to take action. This is the only way we're going to help flatten that curve. So as we see those numbers increase, we should all remember there's more that we can do to protect ourselves and our family and our grandparents and our parents and our neighbors. That action makes an impact not only on those cases, but more importantly, on our hospitals and our ability to care for those that really are in need. Thank you.
Thank you.
Okay, next we have Channel 17. Anyone on the line with questions?
It's Bob Price.
Hi, Bob, go ahead.
Hi, yes. Kind of following up on the last question. Does the county try to track the origin of the positive test? That is, and I know it's an inexact science, but do you interview people who have tested positive to try to get some idea of under what circumstances? Obviously, some people are in, elder care situations. Do you ask them if they think they contracted the virus in social situations or grocery stores, or do you try to find out where it came from?
Yes, Bob, we're going to have our lead epidemiologist, Kim Hernandez, answer your question. Give us just 1 second.
Thank you.
Hi, Bob. The short answer is yes. For all of the cases that are reported to us, our staff, our nurses, call and reach out, and we ask them lots of things, including where they have been, one, to find out where they may have been exposed, and also to identify if they have, there are any potential exposures from that particular patient. So we notify, or we contact all of those patients and follow up with them, and we are always looking to see if there is a specific circumstance, an event, or a location where people are continuing to identify having either been there or have potentially created an exposure in those locations, so we can continue to notify the public and those locations of a potential exposure whenever they occur. Thanks.
So you do that for contact tracing, but do you also try to draw any macro conclusions? Social gatherings are especially troublesome, or grocery stores are, or have you drawn conclusions?
So in many cases, in many instances, we do have networks of people who are related in their same household who also come up positive. We do know that we have had clusters in our SNFs, for example, where those are something that is easy to track. The community type settings, the grocery stores, for example, are much less prominent in those types of discussions because the amount of contact is usually a much shorter duration. But those are things we continue to look into, which is why we look for the entire history of where this person has been in the 14 days prior to their symptom onset. We're looking for just immediately before their symptoms started to know where exposures might have been. So we're looking into all of that. And if, of course, at any time, if we identify, if we identify a relevant community exposure that needs to be notified, we reach out to those locations.
Thank you.
Next, we have KNZR. Do we have anyone on the line with questions? Okay, and KUZZ? Anyone on the line with questions? Okay, we've gone through all of our organizations. We're going to go back and ask if you have any follow-up questions. Ralph, I'm going to start with you because I cut you off last week. So if you have any follow-up questions, please let us know. Okay. That concludes.
I don't. Thank you.
You're welcome. That concludes our briefing for Monday. We'll be back on Thursday with another briefing related to COVID-19. Thank you.